for which you were not prepared. This is what happens. And Amita, please come back. This is what happens, I think, which leads to sudden outburst of reactions. And that has been happening, as you see here, 135 years ago in the history of medicine. Is it happening only in Mumbai? Is it happening only in Maharashtra? No. It's a global phenomenon. We have got case reports from USA, Turkey, Nepal, Pakistan, China, and Japan. Everywhere there are instances on attacks and violence on doctors. Recently in China, one dentist was killed. Can you imagine this? In a patient 20 years after he treated his patients, and the patient was agreed, this indicates. Now what does it tell? Now this is a different situation. 20 years later, somebody from the family comes and kills the dentist. Look at the vengeance. Again, I narrate to my personal life history. This time I was a professor of Nair Hospital. Shilpa, you will remember this. This happened in 1999-2000. We had a very illustrious medical specialist, Dr. Jaikar. Extremely brilliant. In private practice, was respected by one and all. One late evening night, after finishing his clinic, he was going back home when he was shot point blank in the staircase and Sir died. This happened sometime in 2000-2001. Mrs. Jaikar was our colleague from pediatrics. She eventually migrated to Australia. When this case was unfolded, it was evident that one of the patients who had died earlier, about 6 months earlier, out of his disease, had pre-planned that vengeance and that murder about Jaipur and came and shot her. So the message here is that the violence against medical fraternity need not be always what I can say, a snapshot reaction, but it can happen in a pre-planned manner, and that is what happened in China. Therefore, I tell to all 12 standard aspiring youngsters, practicing medicine is injurious to health. But still we all do. I don't think we have any choice. So how can we safeguard ourselves? That is a question. Let's analyze why do these things happen. It's a long list. Poor quality of emergency care, poor grievance redressal mechanism, poor pre-hospital emergency care network, poor communication skills of healthcare workers, lack of emergency resources, emergency intake capacity is overwhelmed, nursing homes lack emergency services, lack proper training, mistaken public belief that hospitals should give its services completely free. In India, education and health, everybody feels that I am a born Indian, so I have a born right to get free health and free education. I can tell you, after 4 years in private sector, I got the best of private sector and public sector. I openly say there are great people in the public sector, there are good people in the private sector also. We need to combine. But I can say with conviction, there is nothing like a free medical care. In public hospitals like JJ, KM, when we say free, it is cross-subsidized by some other route. It cannot be a free lunch. Increasing education, intolerance, fearlessness against rule, that is what has happened. High workload, lack of civil responsibility, and so many other conditions which we all are aware of and which we face almost on a day-to-day basis. So if we say we have to stop workplace violence, we have to come out with a plan of 4 P's. A is policies. We should define how the healthcare is to be given. To stop violence at JJ or KM, we may have to work at Badlapur, Wangni, on the western side near Vapi, and set up centers so that people get the healthcare closer to their homes. This cannot be done by Dean or KM, but this will be done by the policy makers who plan the healthcare for the subsequent time. then we should practice it. There are so many lovely skills in corporation, in government, everywhere. I mean, you feel proud of them. But when the actual implementation starts, there are problems. But I'm convinced that if there is a good work to be done, we must work with the government. Because then we can practice those things at far and distant places. And all these 3 P's eventually lead to the prevention. In all my life, till I became dean, which was about 15 years back, I was just a surgeon. I believed that surgeons are the supremos and they do the best of the world. In 2005, I became dean. For the last 15 years, I'm doing healthcare administration. And I can now staunchly and clearly say that preventive work, preventive departments, preventive aspects working in the community are far more important than the actual preventive work that goes on. And this comes from my heart, this comes from my brain. Once the people who are in policy planning and preparing are convinced that we should spend more in the community, you need to breathe less in your hospitals. It is not the class. It is not the class that is the bar. I have had problems here. This is our KM medical ward. I have also had problems in Prince Ali Khan Hospital, which is a private sector. Fights happen, arguments happen. It may be the causes may be different. Here, it may be the care or the sudden death. Here, it is the bill and a constant nagging that you have done it something which was not required, which was duplicated, and again in the event of death. It surprised me that I had very funny responses in KM and Nagar. Sometimes the people used to say, "Sahab, आमच्याकडे पैसे नाही, काय नाही न्यायला, body तुम्ही घेऊन घ्या." And that used to be a headache that the dean literally used to run, "Baba, body घेऊन जा." आता काय करणार? I faced the same thing in Prince Ali Khan Hospital. Sahab, देव काय bill तुम्हाला, घेऊन घ्या, तुम्हीच क्रियाकर्म करा. So the problem is that it is not the class, it is not the brain capacity where the mentality changes. That is the important distinction. Everything, whether it is a dance or whether it is a fight, it takes 2 to tango. Please remember that when we say patients and relatives, you are wrong, the 4 fingers also get directed towards ourselves. Let us not be either of Bapuji's third and I have added the 4th one. Either we are seeing the problem, but we don't work towards that. Either we hear it but pretend that we have not heard it. Either we know that something needs to be done, but we keep quiet and we don't speak. And that's the last one, which is all of us, that we are too busy now with the cell phones. This has led to the current situation of apathy and anarchy in healthcare. Communication barriers. Now see, when I did my human resource management, my hospital management degrees, there used to be long questions on communication barriers and things like that. That in Mumbai, you get patients from Uttar Pradesh, Bihar, Assam, Orissa, Pondicherry, and then what happens? The cultures are different, the languages are different, but no, there is something more than that. You know, the first thing is, you and the patient's relatives are not on the same page. When I tell that your relative, your mother, or your son is not doing well, she has a thought block here. She cannot understand. She only hears what the words that I am saying, but they don't sink inside. And that is what I mean by saying that you and the patient, you and the relatives are not on the same plane. So what do? Then that leads to break in the temporality of your thought process. The words, the meaning of those words which I am saying, they don't reach her. They may fall on her ear, but they don't percolate into her understanding. So, some pearls of communication to avoid such conflicts. First, ask the relatives their names. आपका नाम क्या है? आप क्या relation में हैं इनके साथ? Just 2 questions and address them. प्रसाद जी, बैठिए, मैं आपको कुछ बताना चाहता हूँ. Ask the relatives their name. Address them with the name. Make them sit and comfortable. Usual scene in a busy hospital like KM, I remember our casualty. The boy poor registrar sitting there, a long table, at least 50 relatives around him. And then he saying, वो 4 नंबर वाला ना, वो कुछ उसका कुछ खास नहीं, वो कभी भी जा सकता है. Very standard statement. And and that leads to his confidence. So make them sit and